Simplified explanation. Necrosis is a type of cell death that happens after an outside injury damages the cell. When the plasma membrane breaks, the cell leaks its contents into surrounding tissue. This causes enzymes to digest the cell and proteins to break down. Unlike apoptosis, necrosis triggers inflammation in the nearby tissue. One common type is coagulative necrosis, which usually happens after ischemia, lack of blood flow, or an infarct, blocked blood supply, in most body tissues except the brain. In coagulative necrosis, enzymes that would normally digest the cell are also damaged, so the cell structure remains visible, even though the cell is dead. Nuclei disappear, but the cell outlines stay. The cytoplasm becomes pink because it binds more strongly to eosin dye. This is called eosinophilia. USMLE Question 1. A biopsy from the kidney of a patient who suffered a heart attack shows preserved cell outlines with no visible nuclei and intense pink staining of the cytoplasm. What type of cell death is most likely present? A. Apoptosis. B. Liquefactive necrosis. C. Caseous necrosis. D. Coagulative necrosis. E. Fat necrosis. Correct answer, D. Coagulative necrosis. Explanation. Coagulative necrosis occurs after ischemia. Cell structure is preserved, but nuclei are lost. The tissue stains pink due to protein denaturation. Why not the others? A. Apoptosis does not cause inflammation and preserves cell membranes. B. Liquefactive necrosis breaks down tissue structure entirely. C. Caseous necrosis has a cheesy appearance and is typical of TB. E. Fat necrosis affects fat tissue, usually after trauma or pancreatitis. USMLE Question 2. Which of the following best describes a key difference between necrosis and apoptosis? A. Necrosis is ATP dependent, while apoptosis is not. B. Apoptosis causes inflammation, while necrosis does not. C. Necrosis results in cell swelling and membrane rupture. D. Apoptosis always leads to complete tissue liquefaction. E. Necrosis is associated with nuclear fragmentation only. Correct answer, C. Necrosis results in cell swelling and membrane rupture. Explanation. Necrosis involves cell swelling, rupture of the membrane, and release of cellular contents, which leads to inflammation. Why not the others? A. Apoptosis is ATP dependent, not necrosis. B. Apoptosis is silent and does not cause inflammation. D. Tissue liquefaction occurs only in certain necrosis types, not in apoptosis. E. Nuclear fragmentation is seen in apoptosis and some necrosis types but is not the only feature.